Okay, we have a beautiful graphic here. I'm going to pull it into PowerPoint just so I can get some measurements on it a little better. To do that, I'm going to do a search here for snip. The snipping tool is a tool on PC that allows you to grab a portion of a screen and copy it into another program. I'm going to just click New Skip, Snip, and do this here. Open up a PowerPoint, and then I'm just going to Control V to paste that there. By the way, if you're on a Mac, you might do something like do a Google search for snip on a Mac, and you would have some opportunities here. So this is something that'll get your entire screen. It looks like Command-Shift-4 will let you do the thing that I just did. So once we have this, one other thing I want to do, I'm going to grab a line. By the way, you don't have to pull it into PowerPoint. This is so, okay, I'm holding down the shift that'll turn that line into a straight line. This is basically just so we can see this on the video. In real life, you could just hold a piece of paper up to the graph to interpret it a little better. What I want to be able to do here is find a survival rate. Let's say like 5-year survival rate would be about 60 months. And this way I can see where these survival rates cross that 5-year period. So in particular, let's just look at an age group. This purple is the 75 to 84 year age group. And might as well just go all out here now and get a second one that is horizontal. Let's do that, and let's make it red too. Okay, so where that purple crosses there, so we can see it's a little over 0.6. In other words, the 5-year survival rate for kidney cancer specific, we're not talking about people who get hit in a automobile crash or some other reason. In terms of from the point of diagnosis to the point of death from kidney cancer, we have the about 62% of these people in the 75 to 84-year-old age group would have survived kidney cancer for 5 years. And we can do this anywhere on the graph. We can also notice that this is people under the age of 50, so 49 or less is the blue curve here. And let's move that bar up there. So we can see that the kidney cancer specific survival rate for that younger age group is much more positive, much more optimistic, over 80%, maybe 82, 83% of them have survived 5 years past the point of diagnosis. So what this article is saying is that in general, the earlier you are when the cancer is diagnosed, the greater your chance of survival. Now, that could be because the younger body has more ability to fight off the cancer. It could also be because we're detecting it at a earlier stage of the cancer, which certainly improves the prognosis. Let's take a look back at that article for hazard ratio. What does it tell us about that? If we go up right above this, it started to say for those aged 70 to 84 years, so that's that highest age group, when compared to those aged 12 to 49 years, the adjusted hazard ratio was 2.14, and then it gives this confidence interval of 1.92 to 2.39. What does that mean? Well, let's take that 2.14. That means over any time period, the people who are diagnosed in that older age group have 2.14 times the risk of dying in a given day, in a given week, month, year. The assumption here is that that hazard ratio is the same at any point on this curve. Now that may or may not be true. Matulsky goes into that assumptions a little bit. So do we see that happening? Let's take a look at what we saw happening there. So here we had, for the roughly 5-year survival rate, we had 82% chance there of survival. And here we see about 61%. Let's throw that in the spreadsheet. So we have 82% chance of survival. This is the younger group. And we said a 61% chance of survival for the older group there. So why would we say that these are almost twice as likely to die as these? Neither of those numbers is 2 times the other one. But keep in mind, these are survival rates here. The danger here is the death rate, correct? So we'll take an equal sign, 100%. The more morbid side of this 82% statistic is that 18% of these younger patients have died with kidney cancer related causes. And I'm going to just drag that formula down here, clicking on the left mouse button and dragging it down. And looks like 39% of the older patients have died in the first 5 years following prognosis. And that hazard rate, if we would take another equal sign, take the percent of the older ones who have died. Oops. Sorry, I lost internet there for a second. If we take the percent of the older ones who have died, divided by the percent of the younger ones who have died, we get 217%, which is the same as 2.17 times the risk of dying for the older group as the younger group. And if we go back to that article, that 2.17 matches up pretty nicely with this 2.14, especially since we were doing a little rounding on the fly there. So what does this confidence interval mean? 1.2 to 2.39. It means that, yeah, these are the people we have data on, and we also have people that could get diagnosed right now with kidney cancer who are not in this data set. Clearly, we want to know what's the relative risk, essentially, for the younger group as the older group. Let me write these two numbers, 1.92 and 2.39. I'm just going to write that 1, 2. Notice 1.92 is the same as 192%. 2.39 is the same as 239%. To convert decimal to percent, you're just shifting over 2 places to the right. So maybe we want to know, what's the chance that a younger person relative to an older person getting diagnosed with this kidney cancer? What's the chance of them dying? So one thing we could do here is take the reciprocal, 1 divided by, oops, make a equal sign there so it's a formula. We're seeing this reciprocal a lot because it's the way that you flip a percentage. I'm just going to change these real quick to percentages, then I'll interpret them. So say that my sister who's 38 right now gets diagnosed with kidney cancer, and I want to know her risk of dying within the next 5 years compared to an older person who gets diagnosed. Well, this percentage right here gives me the risk for the older people compared to that of the younger people. These reciprocals give me the risk of the younger person compared to the older person. So in other words, based on this article, my sister would be somewhere between 41 and 52% as likely to pass away in the next 5 years or 10 years or any time period as an older patient with kidney cancer in any given time period. So this is from the perspective of the younger person comparing themselves to an older person. These are perspective of the older person comparing themselves to the younger person. So let's finish off with this graphic. Again, one of Motulsky's critiques, or one thing he sees as a weakness of the 5-year survival rate, doesn't really tell you long-term or short-term what your chances of survival are. That the survival curve gives a much richer picture there. And this certainly is a really nice, helpful statistic for someone who is, let's say that we're in this younger age group getting diagnosed, or someone that we know is in this younger age group. So we know that the chance that they might die in 5 years is 19%. Does that mean that the chance they die in 10 years is 38%? Does it double when you double the time? Well, not at all, and that's why this is helpful to see. So if we look at double this would be 120 months. That would be 10 years. Their chance of dying is actually only about 22%, maybe. They went from 19% chance of dying in 5 years to 22% chance of dying in 10 years. Let's go crazy here. Let's look 20-year survival rate is 73% or something. So maybe we say 27% chance of dying in 20 years. So basically, if they survive that initial diagnosis, probably, I'm totally guessing here that it wasn't a high stage, it wasn't metastasized when they were diagnosed, then it's a very good outlook long term. So that's why the 5-year survival rate could be kind of scary if you then say, well, 10 years at 40% chance of death, 15 years, 60% chance of death, 20 years, 80% chance of death. That's not at all true. And we can see that using the survival rate. We can actually go to any time period here along the x-axis and be able to get a sense for what the, on average, the survival rate is. And as the Mayo Clinic article tells us, then we might want to know more specifically based on our race, our specific lifestyle habits, the stage of our cancer. And we could certainly get a more specific, perhaps even survival curve, but certainly get a more specific sense of where we fall relative to everyone else who has had kidney cancer.